Hi, good afternoon, good morning, everyone joining us. My name is Sarah Harris, and I'm the Policy and Government Relations Lead at Organon. I'm really excited to be here with you all today to moderate this workshop discussion on women's health across the MENA region. Today, we're going to explore the digital solutions that are linked to improve access to reproductive health and mental health services. It's also my pleasure to be joined here today by three inspiring female founders: Doreen Tutkian, the founder of Omgyno; Sandra Salami, the founder of Sira; and last but not least, Yasmin Muallim, the founder of Maternally. I'd like to add that these founders are also the winners of Organon's Femtech Accelerator program that was delivered in partnership with Flat 6 Labs and completed just over a month ago. So to start us off, I'd like to ask each of you to please introduce yourselves and share with our audience a bit about the startups that you have founded. So I'll start with Doreen and we can go to Sandra and Yasmin.
Thank you so much, Sarah, and thank you for joining us today. I'm going to share my screen with you now so that I could tell you a little bit more about Omgyno or Omgyno. Anybody can say it the way that they want. So Omgyno is about creating more value in gynecology, and it is about technology and progressive values in order for us to redesign the gynecological experience for a lot of women. So we all know that there are quite a few challenges, which we will later on discuss, as to why women don't really get tested for their reproductive health, leading to a lot of problems down the line. So our solution is to build a community that is content-driven, that is progressive, that provides up-to-date information in a way that people can easily understand, that is also inclusive, and based on the values of female empowerment and positivity. And with this community that we build and we educate these people, we also provide them a combination of two services. And this is at-home gynecology testing, so to do a vaginal smear culture for vaginitis, for HPV molecular testing, for UTIs and some STIs. And also, we put people in touch with a doctor that is recommended by the community and vetted by us for them to be able to receive further care. So that how the product actually works is that it is a kit that is ordered on our web app, and that it gets delivered to the user who takes their own sample. This methodology is fully proven and has been actually adopted by the NHS in the Netherlands National Health System and many companies in the US. And the swabs are actually certified globally. And after the person takes their own sample, we pick it up from them, we take it to a certified diagnostics lab, and the patient gets their results within 3 to 5 working days. And then if they needed further care, immediately within 24 hours, they can book a telehealth session with one of our doctors for a virtual consultation. I'll be happy to take more questions later on, but I'll stop there for now. Thank you.
Thank you. Over to you, Sandra.
Hello, everyone, and thank you for joining. Thank you, Sarah and Organon, for this great opportunity. My name is Sandra Salami. I'm the founder of Sira, or in Arabic, Life Journey. Sira is an online mental health platform that aims to normalize and democratize mental health. And since our audience here today are mostly doctors, so I'm just going to present a quick presentation on what Sira can bring to the healthcare and to hospitals and doctors out there. So we all know it has been doctors are all the time stressed. This is a story of Amira. She sees patients day in and day out. She's under a lot of stress, and really she's not well emotionally. She's emotionally drained. She also doesn't have time to take care of her family properly. She's overwhelmed by parenting struggles, juggling between work and hours. Hours at work. She doesn't know who to go through as a doctor, who to talk to as a doctor, and how to process all these emotions. She's not trained to look inwards, and is as well. I mean, she's a medical expert, but has no awareness of her mental health issues or struggles. And this is why Sira is a safe space that aims to normalize and educate and raise awareness on mental well-being. So be it doctors, be it nurses, medical staff, even patients that go through a sickness or any kind of struggle health-wise, Sira can respond to the needs of all those users, can promote mental well-being so that they can have better quality of life, so that they feel that they are not alone, so that they are accompanied. So imagine a hospital where doctors are trained by mental health experts to not only recognize mental health struggles in their patients, but also in themselves. Imagine targeted workshops that are given to patients who are going through chronic diseases or any kind of medical intervention, and they are prepared mentally, not only physically, so that they can heal faster and better. And where learning can spread not only to mental health conditions, but also to different struggles that we go through in our lives, like parenting, like couple struggles, individual struggles, dealing with work stress. So Sira is a safe space. People log into our platform, to our app, to anonymously if they want. They feel that they are not alone. They join discussions and roundtables and workshops moderated by mental health experts, so that they not only learn from experts, but also from others who share their struggles. Thank you.
Thank you. Yasmin?
Yes. Hello, everyone. My name is Yasmin. I'm very glad to be here, a part of Oscar, and I'm very happy to be with you again in a panel, Sarah, Doreen, and Sandra. My name is Yasmin Al-Muallim. I'm an international board-certified lactation consultant, a mental health first aider, and a breastfeeding counselor, and I'm the founder of Maternally, which is an online platform that caters to women's mental health needs during their motherhood journey. It provides women access to healthcare providers, resources, and self-care material will be reliable, evidence-based, and up-to-date. In addition to that, Maternally will be having a community for social support. Thank you so much.
Thank you. And thank you all for sharing, your incredible innovations and areas that you're focusing on. And let's get into the discussion. So I might start with you, Doreen. You mentioned in that opening that your offering is redesigning the gynecological experience. Can you share a bit with the audience, the reasoning behind this type of reproductive health service redesign? Why was there a need for this?
Thank you, Sarah. Well, I grew up in Lebanon, and as we know, even though Lebanon is relatively not so conservative, throughout the Middle East and different parts of the world, there's a lot of conservatism when it comes to female sexuality. This is a taboo subject, and this leads to a lot of women actually not getting tested. And the results are that cervical cancer death rates are on the rise. And the World Health Organization knows this. There's a lot of statistics that are actually proving this. And the reason is that there isn't much awareness or education about how to protect yourself and how to get tested. The rest of the world, the more developed world, has actually been dealing with this subject by creating more safe spaces, educating people, and providing at-home testing through their national health systems, because it is a form of convenience also, but also a form of privacy. And this is what we're trying to create in our region, so that we could give people access in order for them to be able to self-care, to be in control of their bodies, and not to have to pay the price for this taboo subject. So this is all about communities coming together and realizing that this is a very important thing for women, and to finally solve this issue, or at least try to help eliminate the dangers of HPV and cervical cancer and other STIs that lead to further issues with reproductive health.
Yeah. It's such an important point, and absolutely, like, culture plays such a big part of this, right? So it's great to see that there are steps that are being taken to try and overcome this in some way, a step towards it, right? Mm-hmm. I might now turn a little bit to Sandra. So in your opening, you were talking about, mental health and the importance of being able to access mental health services. And you spoke a bit about mental health and physical health. Can you tell us a bit more about how you make the connection between mental health and physical health, and how does Sira's offering work to address both?
Sure. So it's undisputable today. I'm not teaching anything new to our audience, especially doctors who are experts in the field. Today there's a huge link between physical health and mental health. They go together, and we're seeing more and more an educational strive to raise awareness on this link. If you look at diseases today, top diseases are really non-communicable diseases. So those are sicknesses that don't come from a virus or a bacteria. And we still don't know today what triggers this mechanism, these struggles inside the body. It's being, there are more and more research and links that stress stress and negative emotions, keeping emotions in and not dealing with your mental health directly affects your physical health. And this is the message that we're getting across also through Sira to our audience in the Middle East, where there is a big rise, a high rise in diabetes, in obesity, in addictions, especially from a young age. So we're seeing our young, really 50% of the youth in the Middle East statistically are, depressed or not well. So this is a big topic for us, and through Sira, we tackle this right on spot on. So we organize roundtables weekly on different topics related to mental health and how mental health can impact physical health and vice versa. So we have people who are going through life or physical conditions, chronic diseases, maybe cancer, struggling to get over a sickness, and they need to have a strong mental health because it's correlated. So we see if you really believe that you're going to be okay, if you have a positive attitude towards what you're going through, you can heal faster. You're more likely to stick to your meds. You're more likely to continue treatment. You're more likely to go through this without go through the sickness without keeping a trauma or wounds or feeling desperate or without getting sick again. So there's a huge research about that. Even in our sessions, we always invite a doctor and psychologist to talk about both areas together. For example, yesterday we had a session on emotional eating. I would have never imagined that we'd be talking not about anorexia, not about bulimia. Those are disorders. They are medical disorders. We all know about them. Now we're talking about emotional eating. So you eat because you're stressed or because you're sad or because you're happy. And in our culture in the Middle East, food is a remedy. It's an escape. So we had a dietitian and we had a psychologist explain the link between your body needs and your emotional needs and how they're both interrelated. And sometimes you can't you can't differentiate between both. So definitely we're on a journey to educate people more and more on the importance of mental health, the importance of taking care of yourself so that your body can be healthy, not only your mind, and can reflect on a better quality of life.
Thank you, Sandra. I love that you started off by saying it's undeniable. We know this now. We know, and we're more able to speak about it a little bit openly. We started with Doreen with an angle on taboo topics, and this, in some way, has been a taboo topic in itself for a long time. So the fact that connection is undeniable, and the point around the link of your emotional health with your behaviours is that demonstration of how it's connected to physical health. So thank you. I'll stick to mental health and come to you, Yasmin, and dive a little bit deeper on maternal mental health. So from your perspective, what are some of the specific mental health needs that arise during the journey to motherhood?
So I would like to first talk about the numbers, some statistics about maternal mental health. As per the WHO, 1 in 5 mothers experience a mental health disorder during the perinatal period. And in the UAE, a study showed that 1 in 3 mothers experience a mental health disorder. The Centers for Disease Control and Prevention, the CDC, recently reported that over 80% of maternal deaths between 2017 and 2019 were preventable, and that mental health conditions were among the most frequent underlying causes of the death in the US. And just to have even more perspective and to see how significant the problem is, in the US, the economic impact of untreated maternal mental health disorders is estimated to be $14 billion. All this shows how real the problem is, but unfortunately, we do not have as much studies, and we do not have in this region the problem quantified, which definitely makes it lose its urgency and its importance. Now, when it comes to the causes of mental health disorders, there are many factors contributing to that. It could be because of the hormonal and physical changes, because of traumatic experiences, lack of support, lack of sleep, because of socio-economical situations. This is all exacerbated with women with a history of mental health disorders before conceiving. So they are more likely to experience perinatal mood and anxiety disorders. The effects of maternal mental health disorders, the effects they have on women, the child, the family, the society are really major. Mental health disorders and the comorbidity of depression and anxiety could be detrimental in cases of women during their motherhood journey. Unattended and when untreated, mothers are putting themselves and their children at risk of negatively impacting the child's growth and development. The mother's well-being is negatively impacted. And of course, in extreme cases, this could lead to suicide and infanticide.
It's, I just have to let that sink in for a minute, right? I think the data speaks really for itself with what you're saying, and it's an obvious area that needs greater attention and greater focus. And I'm very glad that you're focusing on that space with your solution with Maternally. And I might stick with you with another question, actually, and ask, what are some of the challenges that healthcare professionals and providers might face when supporting women during their motherhood journey, and what can be done to better support them?
Our research indicated that healthcare providers, especially family physicians and OBGYNs, who are in close contact with the women during their motherhood journey, they have noticed that there are barriers that prevented women to talk about mental health care and their mental well-being, either because they are not aware about the mental health disorders and do not have information about the different perinatal mental health conditions. They do not acknowledge their need for support, or they do not know about the availability of support, and of course the stigma around the topic. These barriers are there whether the women are alone during the doctor's visits, or when they have doctor's visits with their husbands or with someone else from their family. Another barrier from the mothers, the husbands, the family members is the fear of medications and not understanding the side effects these medications might have on the woman, her pregnancy chances, the fetus, and breastfeeding. A specific problem that comes up in some cultures and in some families is having the family member with the woman during the consultations do all the talking with the healthcare provider, convey their opinion and their fears, despite the healthcare provider to talk to the woman directly, trying to ask them and address the questions to them, and in some cases trying to ask the person with the accompanying the woman to leave the consultation room. And during some of these consultations, the person accompanying the woman would not accept a medication to be prescribed to the woman in fears it might not be compatible with pregnancy. They do not want her to wait to try to get pregnant for more than the common 6 weeks postpartum that is usual, and instead they want her to try to get pregnant immediately as soon as she has the okay to resume her marital life. And so ignorance, they prevent the woman from having mental health care, fearing she would be taking the medication that is, as per their understanding, could affect and could be impacting the pregnancy. Other barriers that up are not enough time during the consultation, insurance and payment issues, of course, and loss of patient follow-up. So what we are trying to do is to bridge this gap. We want to bring healthcare providers closer to mothers, especially mothers who do not want or can't see a mental health care provider. Healthcare providers will be able to connect with them virtually online on our platform during a suitable time that both parties agree on. On our platform and with the proper aid, healthcare professionals and healthcare providers to recognize signs of disorders, OBGYNs who are especially more able to see mothers and communicate with mothers during their motherhood journey, are able to maybe be the first contact person and will be able to recognize these mental health needs early on during the motherhood journey. So we will try to make it accessible and effortless for healthcare providers to easily detect, diagnose, and refer mothers to specialists who will be part of this treatment journey to be able to support mothers better.
Thanks, Yasmin. There's a lot of touch points there and a lot of challenges that really can be faced. And I think what you're saying as well is how do you design these services and how do you place women at the centre so they are able to access what is needed along that. Thank you. And on that, back to you, Sandra. what do you think can be done to improve or ensure that patients who require the mental health support that they need can actually access those services? I think Yasmin touched on that, but if you can also carry that forward.
Sure. So there's a huge, I loved what Yasmin ended with, the role of the doctors today, and since our audience are all from the medical field, the role of the doctor today is such an important role in guiding patients on the importance of mental health, on being able to detect the signs even in their patients, and telling them that they need help. This is one point. The second point, just to close on what Yasmin was saying, we're also seeing doctors themselves are really burned out. They are so stressed. It's a high stigma in the medical community to say, I'm going through something, I need support so that I can do my job better. So it's a message today to all our audience that all of us were responsible to reduce the stigma and the taboo around mental health, because we all struggle, we all go through struggles, and it's better to be preventive than to be reactive. And this is where, Sarah, your question makes sense. Today, all the solutions we're seeing in the market and available to us are all reactive. We wait until we're in a crisis point to go get help, to see therapy, and there's a huge shortage. I'm not going to talk worldwide, I'm going to talk in the region. It's expensive, therapy is expensive, there's a shortage, there's a lack of maybe of finding the right resources, it's not easy, and there's a huge barrier of stigma. If you're going through something, and your entourage knows about it, you're automatically discredited if you're working. It happened to me. I mean, as a professional at work, I went through my own crisis, and I had the community around me ask me, are you still able to manage? Are you still, so the credibility is practically, challenged. Your entourage, the neighbors, the mother, there's a culture here around us. Your mental health is so shared in the community, not even yours. So this is why CIRA today is in the part of the collective. So we work a lot on the preventive aspect. We educate, we raise awareness so that people don't reach a crisis point. We work in prevention. It's less costly. It really gives us a chance of building a healthier life. We talk about all kinds of struggles, not only diagnostic mental health conditions, those that are not the crazies or the schizophrenia or the bipolar or whatever mental health conditions out there. We talk about everyday struggles, everyday stress related to all aspects of our lives. Those build up, and those get us to a point of depression or anxiety or having mental disorders. So we work on the preventive, as I said, and on the collective. We put people in groups. We put people together. We create a sense of community, because really what you experience through CIRA, and the research is backing us up, is that you heal when you realize that you're not alone in your struggle. Whatever you're going through, there's at least 1,000 out there who are the same, who have the same taboo, who are going through the same thing. So you feel you're not alone. You learn from experts, but you also learn from the community, and we help each other with this. We support each other. This is for us the best journey. It should be accessible and available to all. Today, there's no doubt that mental health is a human right. It's not even a service anymore. It's a human right, and we all have a responsibility to make that happen in our societies and in our in our part of the world. That's my 2 cents.
Yeah, no, and it's so important. And I think you're touching on the different ways in which to access the design, maybe, of how those services are provided to ensure that uptake is taken. And I think, that's an important point on design. And that kind of brings me back to you, Doreen, and maybe where we started the conversation. From your perspective, taking this, conversation forward, what's the impact impact of creating a user-centered digital health solution, and has, from what you've seen at OmGyno, have the impacts been realized through adoption of the solutions, both from the perspective of the patient and the doctors?
So that's a really long topic to discuss. In terms of the impact, so first of all, I would like to start saying it's all agree that reproductive health is something that concerns everybody and not just women or people with the female reproductive system. So first of all, to put what we do in like a niche is already a bit of an issue. And we realize this over time because when we want to create impact, we want people also to join in and to say that this is an important topic. So when it comes to investments and partnerships, we need people to do something very important to take care of. At the same time, we have started this project in 2021, and we are fully operational in Greece at the moment and just moving now into Lebanon. And we also have taken this time, me as a designer who also studies how digital technology is what we call the cultural appropriation of digital technologies, and how it is also being integrated into all of this. Meaning, when you are coming into an existing traditional, let's say, healthcare service, and doctors who are now listening to us know this very well, getting in there and trying to introduce technology to change things can also be something that people resist, right? It's kind of like, imagine, 10 years ago, if you told the taxi driver that was just doing his thing that Uber is going to come, immediately they would think, oh, like this is going to take away business. And what we're trying to do right now is for people to realize that we work together because technology is here, and people are used to convenience and getting used to the ideas of being in control of their health and of their lives, and they're getting used to the idea of having their privacy. And there's also this idea that design is there for the user, so not just the way work has always been done in a top-down manner, but it is now the time where we listen to the patient and the user and we design for that person. So when we do the work that we do, it starts from research where we gather insights from talking to over 3,000 people. And I say people because some people don't identify as women, and that for them is also a subject, And so in terms of how this project has gone and in terms of the impact, the only way that people can really see its impact is if they actually try it. Because there is a lot of resistance in the beginning. Doctors think this might take away business. Patients might think, I've never done this before. What if I do it wrong? So it's all of these questions. And we realize the best way to do it is actually create a lot of information, a lot of awareness, and also provide tests that are for free in the beginning. This was really, really great for us. We have over 350 early adopters in a place that is also very conservative, traditional, like Greece. And this is the reason why we also picked it, because we wanted to be able to do this within EU regulations, to know exactly how to do it the correct way, but we also wanted to do it in a culture that also finds it difficult to move towards that next step, because it's not the US, after all, where this is very common. And we realized two main things, is that the users, the patients, are so shocked that this can be done so quickly and so easily and getting results so instantly that immediately they understand it and they tell their friends about it. And they realize that there's no hoax. This is a fully credible way to be tested, because this is also what national health systems around the world are doing. The doctors, they also get to see time that by being for your patient and offering convenience, they will not let go of you. They will not say, oh, now that I have this test, I will never come to you again. No, they will always need their doctor. And the doctor that is there for them, that is taking their convenience into consideration, knowing that maybe they might, not be doing a pap smear for them, but the reality is they're actually also spending that time giving it to patients that may have more serious needs. And they also realize that being part of our community and seeing that this is an issue for a lot of people, and they're promoted as being a supporter of these values that are progressive and tech friendly, they also realize that they gain in this as well. So the impact that we're seeing is lower than I want it to be, but it's definitely worthwhile.
That's really great. Thank you. Thanks for sharing that whole process that sort of explains, how again that patient is able to access the service and how it works within the broader solution, and the uptake is growing. I'm conscious of our time, so I think that wraps up kind of the formal part of our panel. But I do want to ask one last question of you all, which is, having heard this conversation today, what's your final take-home message for our audience, or maybe a request for everyone in our audience? So I might go back to Doreen, and then Yasmin and Sandra, if you don't mind.
So for us, especially being here with Organon and knowing that at least the work that we do is recognized as an institution, because Organon is also a huge organization, we definitely see the potential of partnerships and working with like-minded people in the medical institutions, doctors, OBGYNs that really believe in this cause and really want to be part of this change. So we ask anybody who finds themselves, implicated in this and feels like they could actually, play a role in this, please do contact us and let's talk, because we're open into getting more people into our community and actually moving forward with our project.
So for me, as I said earlier, there's a clear lack of research and data statistics in the Middle East and Northern African region, and we need to have resources allocated to research to better understand the situation. We need to know the severity of the situation in this region, and research will help us better help healthcare providers for them to better help and support mothers. And in addition to that, synchronicity from all stakeholders, NGOs will definitely move the needle and improve the situation in terms of maternal mental health care. And finally, I would like to say that we would love to collaborate with parties who would visit to work with us to improve the maternal in the region, to make more accessible, and also to increase the data and research on the maternal mental health care.
So for me, maybe reiterating the fact that mental health is a human right. We all have a role to play. So the doctors who are listening to us today, they can influence, they can push mental health by taking care first of their own mental health, by acknowledging and talking about, and that it's really not a stigma. It's part of our life journey. We're gonna go through struggles, and support is there. That's first. Second, for everyone who says that access to mental health services is expensive, it's not available, there's a problem of accessibility, of reach. Sira today is offering its services for free for individuals. So please download the app, go through our roundtables. We talk about everything. There's no taboo, there's no shame. And we're ready to help, we're ready to support, be it in a hospital setting, the medical staff, be it the patients, be it individuals, be it your family, your friends, whoever you feel would benefit from our service. We're there to support through our collective efforts and through raising awareness. It's really very important. It can transform your life. So give it the right priority.
Thank you all. Such incredible last insights and such an amazing conversation. You left me with, there's a real need to partner, an interested partner. So you want to hear from anyone on the audience so they can get in touch. We need data. I think data is the beginning of every conversation. Without it, we can't really paint a picture and begin to design or address the challenges that we face. And, to your point, Sandra, there are solutions out there. It doesn't have to be expensive or complicated. Something is available, and Sira is there as a really clear example. So thank you all. I really appreciate the panel for coming together and sharing your insights from your founder's journey, and to all the audience who have joined us and listened in. If you have any questions, we're going to be dialing into the networking lounge, so you'll be able to interact directly with our panel today and our founders. So thank you all, and that concludes our session.
Thank you so much.
Thank you.
Thank you.